It's time for another warm-up review. Let's get going. In which section of the brainstem is each of the cranial nerve nuclei located? So the nuclei for cranial nerves 3 and 4 are located in the midbrain. Cranial nerves 5, 6, 7, and 8 are located in the pons. Cranial nerves 9, 10, and 12 are located in the medulla. And the nuclei for cranial nerve 11 are going to be located in the spinal cord, which you can remember because cranial nerve 11 is the spinal accessory nerve. Next, which cranial nerve is responsible for each of the following actions? So first we have eyelid opening, that's going to be the ocular motor nerve, number 3. Taste from the anterior 2/3 of the tongue, that's going to be facial nerve, number 7. Head turning, that's going to be the spinal accessory nerve, number 11. Muscles of mastication, that's going to be the trigeminal, number 5. Balance is going to be the vestibulocochlear nerve, that's going to be cranial nerve 8. And then monitored carotid body and sinus chemo and baroreceptors, that's going to be the glossopharyngeal nerve, cranial nerve number 9. Next, which regions of the brain compose the limbic system? So that's going to be the amygdala, the septal nucleus, the mammillary bodies, the fornix, the hippocampus, and the cingulate gyrus. That's it for the warm-up. Let's get to that lecture now.
In this video, we're going to be talking about drug metabolism. So this is where our bodies perform some kind of chemical reactions on the drug, which usually inactivates the drug, or sometimes drug metabolism actually activates the drug. Some medications are really prodrugs, which just means they're administered as inactive compounds, and when the body metabolizes them, then they become active. But eventually, even those drugs are going to undergo further metabolism and become inactivated. There are two basic types of drug metabolism reactions, which we call phase 1 reactions and phase 2 reactions. Now, you don't have to go through both phase 1 and phase 2, and you don't have to do them in order either. You could do a phase 2 reaction first, or some drugs only go through phase 1 or only go through phase 2. Phase 1 reactions are hydrolysis, oxidation, and reduction. And these kinds of reactions result in slightly polar, water-soluble metabolites, which are often still active. Occasionally, phase 1 will inactivate a drug, but sometimes phase 1 reactions can actually activate a drug and make it more potent, like converting a prodrug into an active drug. Or sometimes phase 1 metabolism can actually make a safe drug toxic. For instance, methanol undergoes oxidation, which is a phase 1 reaction. It undergoes oxidation to become formaldehyde, which is even more toxic than methanol was to begin with. Then phase 2 reactions include things like methylation or acetylation or glucuronidation or sulfation. These are all examples of conjugation reactions. Conjugation means you're joining the drug to some other molecule, like adding a methyl group or adding an acetyl group, or you're conjugating the drug to glucuronic acid or to sulfate, or maybe glutathione. And all these phase 2 reactions result in very polar, inactive metabolites that are easy to excrete in the urine. Those highly polar hydrophilic molecules can't cross cell membranes very readily, which means they cannot be easily reabsorbed by the kidneys, and they get trapped in the urine and then excreted. Both phase 1 and phase 2 reactions take place primarily in the liver and sometimes in the kidneys. A drug might go through phase 1 metabolism on the first pass through the liver and then go through phase 2 on the second pass. Or another drug might go through phase 2 on the first pass through the liver and then go through phase 1 on the second pass. Or it might go through both phases on one pass through the liver. It kind of varies from drug to drug. But in general, I want you to remember phase 1 reactions are hydrolysis, oxidation, and reduction, and they create a slightly polar molecule that's still active. And then phase 2 reactions are conjugation reactions that create a very polar molecule that is inactive. There are 3 other quick bullet points I want you to remember. First of all, cytochrome P450 enzymes generally perform phase 1 reactions. We'll come back to cytochrome P450 in a second, but for right now just remember phase 1 is P450. The second quick bullet point is that elderly patients typically lose the ability to do phase 1 metabolism first, but they can still do those phase 2 conjugation reactions like glucuronidation and acetylation. They just lose phase 1 early on. And then the third bullet point is that some people are what we call slow acetylators. They just don't acetylate drugs very readily. Now, what kind of reaction was acetylation? That's a conjugation reaction, a phase 2 reaction. That means that these people are going to be slow to inactivate certain drugs. So if you keep dosing the drug normally, but the patient's inactivating that drug more slowly than expected, that drug's going to build up in the system, and the patient's going to have higher than average drug levels, so that the patient's going to be at higher risk of drug toxicity and side effects. So again, slow acetylators have a higher drug level and therefore more risk of toxicity. So even though most people have to take a drug twice a day, for instance, some people might only need to take it once a day or every other day or whatever the case may be. Cytochrome P450 is a family of enzymes that catalyze a huge variety of reactions. For instance, some of the P450 enzymes are involved in things like bile acid synthesis or steroid synthesis. And then some P450 enzymes are involved with drug metabolism. You'll see it abbreviated CYP, and then you'll see a number, a letter, and another number. So for example, one of the most important enzymes that metabolizes a bunch of different drugs is called CYP3A4. That's cytochrome P450, family 3, subfamily A, form 4. There are about 12 different enzymes that metabolize 85 to 90% of the drugs that we use. The CYP3A4 by itself metabolizes around 50% of drugs. So what difference does all this make clinically? Well, if you give two drugs that are both metabolized by the exact same P450 enzyme, it's going to take longer for both of those drugs to be inactivated because there's only so much of the enzyme around. So if you give both drugs at the same time, you might have increased plasma levels, or you might have prolonged action of one or both of those drugs. That's where drug-drug interactions come from. And then apart from drug-drug interactions, sometimes drugs and foods and even herbal supplements can either inhibit P450 enzymes or they can induce the expression of P450 enzymes. And since these P450 enzymes can be involved in either activating or inactivating drugs, inducing P450 could either increase drug activity or reduce drug activity. You have to look it up and figure it out for any particular drug interaction, but you can't just make a blanket statement. But you need to be familiar with a few of the drugs that are most commonly implicated in inhibiting and inducing these P450 enzymes. So let's take a look at these in the study guide. First is a list of drugs that are well known for inhibiting cytochrome P450. Now, this is only a partial list, but these are some of the most common, most notorious ones that you should know. Now, there are tons of different mnemonics out there to help you remember all these, but our mnemonic is crack amigos. The first C is for ciprofloxacin. R is for ritonavir, which is a protease inhibitor. This is actually a class effect of the protease inhibitors. They're really designed to inhibit cytochrome P450. A is for amiodarone. The second C is for cimetidine. The K is for ketoconazole. Then the A in amigos is for acute alcohol use. Now, chronic alcohol use actually induces P450, as we're going to see in a little bit. But acutely, alcohol intake will inhibit P450. The M is for macrolides like erythromycin and clarithromycin. I is for isoniazid. G is for grapefruit juice. So again, it's not just drugs that affect drug metabolism, but diet and supplements can do it as well. O is for omeprazole, and the S is for sulfonamides. Sulfonamides cause lots of side effects, and they also inhibit cytochrome P450. So if you remember crack amigos, that's going to help you remember this short list of high-yield P450 inhibitors. And if you have a hard time remembering which list is the inhibitors and which list is inducers, maybe think about how crack cocaine is a dangerous drug, and you should inhibit yourself from using it. Or you can think about how drug cartels inhibit law and order. Then on number 5, we have the P450 inducers. And a student at Western U in California sent us this mnemonic. Guinness, Coronas, and PBRs induce chronic alcoholism. So first of all, the G in Guinness is for griseofulvin, which is an antifungal drug. The C in Coronas is carbamazepine, which is a seizure drug. Then PBRs in this case does not stand for Pabst Blue Ribbon. The P stands for phenytoin, which is another seizure drug. The B is for barbiturates. R is for rifampin. And then make sure that you're making this plural. It's PBRs because that S is for St. John's wort, which is an herbal supplement that's supposed to help treat depression. And again, if a patient decides to start taking St. John's wort on his own and doesn't tell you about it, it can induce his P450 enzymes and mess with his drug levels of lots of different medications. So again, Guinness, Coronas, and PBRs induce chronic alcoholism because that tells you that these drugs induce P450. And it also helps you remember that chronic alcoholism will induce P450. But remember, we said that acute use of alcohol will inhibit P450 enzymes. Let's do a quick whiteboard review to make sure you have those two lists down. This is a little game called inducer or inhibitor. So I'm going to give you a couple of drugs and you decide if it's a P450 inducer or a P450 inhibitor. First off, we have carbamazepine and clarithromycin. So carbamazepine is a P450 inducer, And clarithromycin is a P450 inhibitor because it's a macrolide. Next, we have two anti-tuberculosis drugs, rifampin and isoniazid. So rifampin is a P450 inducer, and isoniazid is a P450 inhibitor. Next, we have two antifungals, griseofulvin and ketoconazole. So griseofulvin is a P450 inducer, ketoconazole is a P450 inhibitor. Now we have two drugs used to suppress gastric acid production, omeprazole and cimetidine. Well, omeprazole is a P450 inhibitor, and trick question, cimetidine is also a P450 inhibitor. Now we have two substances that patients might not tell you they're taking unless you ask them specifically about it. Grapefruit juice and St. John's wort, which is an herbal preparation used to treat depression. Grapefruit juice is a P450 inhibitor. St. John's wort is a P450 inducer. And we have two antibiotics, both used very commonly to treat urinary tract infections, sulfamethoxazole and ciprofloxacin. Sulfamethoxazole is a P450 inhibitor because it's a sulfonamide drug, and ciprofloxacin is also a P450 inhibitor, so another trick question. And our last one, we have chronic alcoholism and acute alcohol use. So chronic alcoholism is a P450 inducer. Acute alcohol use is a P450 inhibitor. And what kind of reactions did we say cytochrome P450 enzymes catalyze? Is it phase 1 or phase 2? P450 enzymes tend to do phase 1 reactions. And what are the phase 1 reactions? Hydrolysis, oxidation, and reduction. Great job. I raise my PBR to you. Now excuse me while I shave off this ironic handlebar mustache. Let's talk about the metabolism of ethanol. I'm sure you know that the organ that's primarily responsible for metabolizing alcohol is the liver, and there are two key enzymes that you need to remember. There's an enzyme called alcohol dehydrogenase that converts ethanol to acetaldehyde, and then the enzyme acetaldehyde dehydrogenase converts acetaldehyde to acetate. It's pretty easy. Now, both of these enzymes are dehydrogenases, so they dehydrogenate, they remove a hydrogen. And you have to do something with those hydrogens you're removing, so these enzymes transfer the hydrogen to NAD, which is the active form of niacin. That NAD is a cofactor, and that cofactor is the limiting reagent in alcohol metabolism.
And you also need to know the drugs that inhibit each of these enzymes. The first enzyme, which is alcohol dehydrogenase, is inhibited by a drug called fomepizole. Now, fomepizole is used to treat methanol poisoning and ethylene glycol poisoning. And then the second enzyme, acetaldehyde dehydrogenase, is inhibited by a drug called disulfiram, which we use to treat alcoholism. So let's talk about fomepizole for just a second. Methanol and ethylene glycol are both metabolized by alcohol dehydrogenase. Now, methanol is wood alcohol, and occasionally alcoholics might try to get drunk on methanol. But remember, we said that instead of getting metabolized to acetaldehyde, methanol gets metabolized to formaldehyde, which is toxic. Formaldehyde can cause acidosis, and it can cause retinal damage and blindness, even in relatively small amounts, like 15 cc's or 3 shots of methanol. So it's very, very dangerous. If you drank a whole bottle of methanol, you could die. So to treat methanol poisoning, we want to prevent the metabolism of methanol to formaldehyde. So we want to inhibit this enzyme, alcohol dehydrogenase. So if we give the patient fomepizole, it's going to inhibit alcohol dehydrogenase and prevent formation of formaldehyde. You could also give the patient a bunch of ethanol, and basically ethanol competes with methanol for the enzyme, so that's going to slow down the formaldehyde formation. Or you could do dialysis to remove the methanol. We also said that you could use fomepizole to treat ethylene glycol poisoning. Now, ethylene glycol is antifreeze, right? People don't try to get drunk on it, but apparently antifreeze tastes pretty sweet, so kids and pets will sometimes drink it if they find it. So when you drink a nice antifreeze cocktail, the ethylene glycol gets metabolized to oxalic acid and other organic acids, which again causes acidosis. It's a high anion gap metabolic acidosis. If you remember the mnemonic mud piles for the causes of high anion gap metabolic acidosis, the M in mud piles is for methanol, and the E is for ethylene glycol. So ethylene glycol causes a metabolic acidosis, and it can also lead to kidney damage, CNS problems, and heart and lung toxicity. But especially remember the kidney damage, because the oxalic acid precipitates out as calcium oxalate crystals in the kidney. And again, you can prevent this by giving fomepizole to inhibit alcohol dehydrogenase, or by giving ethanol to compete for the enzyme. So that's the first enzyme. Well, what about the second enzyme, which is acetaldehyde dehydrogenase? We said you could inhibit that one with a drug called disulfiram, and we said we use that in treating chronic alcoholism. Actually, we use disulfiram to discourage alcoholics from drinking. So say you have an alcoholic in recovery and you give him disulfiram, that's going to inhibit acetaldehyde dehydrogenase. And if the patient relapses and starts drinking again, acetaldehyde will build up in his body, and that's going to cause flushing, sweating, headache, nausea and vomiting, and hypotension. So these patients learn not to drink alcohol because they know it's going to make them sick.
You should also know a handful of other drugs that can cause disulfiram-like reactions, like metronidazole, which is the most important one, certain cephalosporins, procarbazine, which is a cancer drug used to treat Hodgkin lymphoma, and first-generation sulfonylureas like tolbutamide, which nobody ever uses anymore. So if you start somebody on one of these drugs, for instance, you start a patient on metronidazole for diverticulitis or something, you need to tell the patient to avoid alcohol while they're taking it because it may make them sick. Now it's time for the end of session quiz, so I want you to pause the video and answer those questions, then I'll go over the answers with you. Let's go through these. First question, which hepatic phase of metabolism is lost first by geriatric patients? That's phase 1 metabolism. And which phase is mediated by cytochrome P450? That's also phase 1. Next, what medication inhibits acetaldehyde dehydrogenase? That's disulfiram. Next one, what medication inhibits alcohol dehydrogenase? That's fomepizole. And the last question, list 7 inducers and 11 inhibitors of cytochrome P450. For the inducers, our mnemonic was Guinness, Coronas, and PBRs induce chronic alcoholism, which stands for griseofulvin, carbamazepine, phenytoin, barbiturates, rifampin, St. John's wort, and chronic alcoholism. Then the mnemonic for the inhibitors was crack amigos, which stands for ciprofloxacin, ritonavir and other protease inhibitors, amiodarone, cimetidine, ketoconazole, acute alcohol use, macrolides, isoniazid, grapefruit juice, omeprazole, and sulfonamides. That's it for now. I'll see you next time.
I don't always get methanol poisoning, but when I do, I prefer fomepizole. Stay thirsty, my friends.